Hello guys, quick video to answer this question from dental exams, and the question was available by the Facebook of the Australian Dental Academy, and this credit given to the question is Dr. Adam's question, alright? So I recreated the image. Let's answer this question. The text is very simple. Patient came with advanced caries but no symptoms, okay, or very little symptoms, which is a little bit easier to happen in the clinic, right? But that's the bottom line. So patient is asymptomatic but with deep caries. What to do in this case? And then you are seeing a cross-sectional schematic drawing showing that the caries are at the level of the roof of the pulp chamber but not yet crossing to the pulp, okay? So what to do here? RCT, well, if the patient is symptomatic, so in many cases you need to open the root canal, but in this case, you know, the pulp chamber is still not contaminated, or you can assume so, and then the correct answer is the letter B, of course, select caries removal, right? So select caries removal is the correct answer of this question. Extraction, of course not, because it's restorable. You can still restore this tooth. Imagine that this is a cross-sectional, so all the other surfaces, mesial, distal, lingual, and buccal, are still okay. Even if one of them is not okay, you can still try to do maybe a crown or something, depending on the border of this surface. So standard stuff here. Extraction is too aggressive for this case. You can still restore. And antibiotics, never, all right? Not even for pulpitis, for pain. Antibiotics is for systemic compromised patients in some cases. So you decide on an individual basis. We have videos to talk about this. Go back to the videos talking about pharmacology, and even I will make available these links on the top right corner of this screen, and even the other videos about caries. We have a playlist of caries. Please do check this playlist, because then you never miss caries again in your clinical and radiographic diagnosis, all right? Let's see just a schematic drawing here, all right? So we need to understand that maybe the caries are coming until here, for example, and even though you have still some dentin here, then maybe the pulp is still contaminated because the radiographs underestimate the situation, all right? Just for you to understand, let's see a schematic drawing of a radiograph. And cases like this, for example, it's unlikely that the patient will be asymptomatic, okay? So in many cases like this, you do need to open the root canal, because you are going to find out that this is irreversible pulpitis, the pulp is contaminated, and maybe it's even necrotic, and then there is no saving this, no avoiding RCT. But in many cases, again, you find this situation and the caries didn't cross to the side of the pulp. You can still try to save this. Okay, let me turn on my Apple Pencil here again. And then sometimes it's here, for example, all right, not here, of course. Sometimes it's here, for example, and you can still save this tooth. The symptoms are still lethal, so you'd give an anesthesia, remove the caries selectively. You can allow affected dentin to stay, but not infected dentin, the soft one. We have a video explaining this as well, and things can be fine, all right? If not, if the pain persists, especially if this pain is growing, all right, then we may have a reversible pulpitis, and then, of course, you're going to open the root canal and never extract oral antibiotics. See you guys very soon.